What is the definition of public health? According to the CDC, it is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. We can define public health through a concept called the core functions of public health. Assessment, policy development, and assurance are the three functions that public health agencies use when we are faced with a problem that can negatively influence health. The first core function, assessment, is correlated with defining health problems and identifying risk factors for certain diseases. Let's take a look at what health problems are influencing us the most here in Monroe County. For most of the 21st century, heart disease, cancer, and stroke are three of the most leading causes of death in Monroe County. But recently, we do have a new problem in our hands, and that would be COVID 19. So, we just wanted to share a little bit of our experience with COVID 19 with you right now.
For over a year, college students have had to navigate very unpredictable changes in learning and living situations due to COVID-19. In spring of 2020, colleges were forced to entirely shift online because of the pandemic. Practically overnight, numerous residential college students lost their on-campus housing, along with their jobs and livelihood. However, others chose to continue working, risking their health in order to help support their families, while others took care of siblings and elderly family members at home. Roughly 15 million undergraduate students have had their lives turned completely upside down and are continuously living in a time of uncertainty. New research from Hobson and Handover Research discovered that 71% of college students say they struggle to stay focused on schoolwork, while 52% say they struggle to complete their coursework and 40% struggle to attend class. Two-thirds of the students that were surveyed say that COVID-19 has somehow negatively impacted their mental health. Students are now facing new challenges, and one-third of these students are having trouble paying for food, school, and housing. In addition, students are concerned now more than ever about their future. Two-thirds of those surveyed stated that they are worried about finding jobs after they graduate. The COVID-19 pandemic continues to have a significant impact on the way higher education students have had to live and work, affecting their physical and mental well-being.
As you can see, the COVID 19 pandemic has not only negatively impacted our overall physical health, but has had other devastating effects on things such as mental health, the economy, and education. As of right now, we are threatened by a new COVID 19 variant called the Omicron variant. What steps should we take to prevent us from returning to life during the first lockdown? This brings us to our next core function, policy development. This step is where we develop and implement interventions to prevent the problem from getting more severe. One example we could look at would be COVID restrictions in our state. Mask mandates were in place in Monroe County and currently in place in some of our surrounding counties, such as Erie County, to limit the transmission of COVID in public places. In New York City, there are mandates to require people to become fully vaccinated to eat in restaurants, and our most controversial mandate was the mandate of vaccinations for people in federal jobs such as teaching, medical care, and senior care. We are now going to take a closer look at controversy that could arise from mandates, such as mask mandates and vaccination mandates.
The main sources of controversy that could arise from the mandates could be based on economic impacts, such as restaurants in New York State losing their business license from unvaccinated people. Some believe that mandates restrict their individual liberty. One example would be mask mandates, but we can also put people who don't like gun restrictions because they would like to see the liberty carry a firearm. Moral and religious oppositions are a source of controversy as well. Sex education in schools was a high debated topic because parents believe that their children should not be taught about sex at such a young age. Lastly, politics versus science is a source of controversy. We can think about how some people may oppose vaccine mandates, such as the MMR vaccine for students who go to public schools, or the COVID vaccine for people who attend public areas, due to the fears of them causing external side effects that weren't scientifically proven.
The last core function we will be talking about today is assurance. Assurance is to ensure that services are available to all. Let's take a look at what these services may be in our county. Homeless shelters for those who are homeless or in need of temporary housing. Safe and clean public transport for those who don't have a car. Grocery stores to find healthy options for food, sanitary objects, and other needs. Healthcare, hospitals, and clinics. free lunch programs for students under the poverty level, Medicare and Medicaid, and then therapists and psychologists for mental health. In order to maintain health in our community, it is important to have services such as these in place. Mandates and policies are also here to ensure that we are living in a safe and healthy environment. We hope you learned some about public health and stay healthy.